Welcome to Voices of Change, a podcast for the Get the Medications Right Institute. We are on the cusp of a new era of specialty medications and gene therapies that will transform care, but we also are seeing tremendous waste. Annually, over $528 billion is wasted, and 275,000 lives are lost due to non-optimized medication use. Misuse, overuse, or underuse of medication therapy can lead to treatment failures, a new medical problem, or both. Consider some of these statistics. 80% of the way we treat and prevent illness is through medications. 1 in 10 Americans take 5 or more prescription drugs. More than 75% of all physician office visits result in a prescription for medication. Annually, more than 4 billion prescriptions are filled in U.S. pharmacies. But there is good news. There are opportunities to control the loss and waste, whether you are involved in receiving, paying for, or delivering care. Living in a world where patients get the right medications the first time is attainable. That's what we're doing at the Get the Medications Right Institute. In this episode, we speak to Tria Health CEO Jessica Lea. As a trained pharmacist, she brings 20 years of knowledge and expertise in managed care and pharmacy benefits as an advocate for the pharmacist's role in improving outcomes. She joins us to discuss this and also offer guidance to employers as health plan sponsors to develop a buy right strategy as they move forward with a new process of care to ensure medications are safe, effective, and appropriate for their employees. And that's what you'll hear about on Voices of Change. Here's your host, the Executive Director and Co-founder of the Institute, Katie Capps.
Hello, everyone, and thanks for joining us today. On today's podcast, I have Jessica Lea, PharmD, CEO of Tria Health. Tria Health is a new executive member of the Get the Medications Right Institute. With 20 years of extensive experience in pharmaceutical care, Dr. Jessica Lea was named CEO of Tria Health in 2010. Prior to her current position, Dr. Lea worked as a clinical pharmacist at MedTrack Services, where she played an instrumental role in the development of Tria Health and other wellness programs. Her background in academia and numerous pharmacy achievements continue to fuel her passion of providing patient-centered care that results in optimal health outcomes. Under Dr. Lea's leadership, Tria Health has grown to become the most comprehensive provider of chronic condition management. As a pharmacist, Dr. Lea is passionate about the role a pharmacist can play to improve health outcomes, which goes beyond the role of the traditional pharmacist dispensing medications. Welcome to the show, Dr. Lea. Do you mind if I call you Jessica?
Please do, and thank you for the opportunity today to talk about something that I'm super passionate about.
So, Jessica, can you give us an overview of your background and how you got into this work with Tria?
Absolutely. When I graduated with my PharmD, I knew from the beginning that I wanted to provide the opportunity for people, including myself, to work with patients one-on-one to help them understand the role that their medications can play in improving their health outcomes. I graduated with my degree and then I achieved a residency and fellowship completion. And through that, was able to begin working in academia by starting out setting up polypharmacy clinics with physicians who were working in the mental health field. That opportunity leveraged my experience with working with physicians and patients and nurses and other healthcare members to work with people who had multiple medication issues, not just around perhaps one condition, but multiple conditions. That then fueled my desire to learn more about managed care. Went into working in managed care in the pharmacy benefit industry, which allowed me a different experience of understanding the way in which we were looking at medications from a cost perspective and a utilization perspective. But I think everything came full circle for me when working with a client, an employer who was working with the PBM at the time, that they were struggling with the fact that it wasn't just that the cost of medications for their diabetic patients was growing. It was the fact that those individuals who had diabetes were continuing to go in and out of the hospital system. And that was when I decided that I needed to help be a part of a better solution, especially for these employers. So through that, I was able to begin working with employers and providing chronic condition management services which allowed for us to put the pharmacist in the role of being a consultative resource for those members and their physicians, which allowed for them to not only understand their medications better, but those medications resulted in their diabetes symptoms improving, their diabetes being under more control, which really results in that whole conversation of the pharmacy and the medical being together, and the conversation having to be holistic for individuals, not just about the cost of pharmacy in itself. So that's really where I got my start, and has to this day led to 12 to 13 years of being in this role at Tria, which has really been a valuable opportunity for me to continue to help pharmacists get the opportunity to do what they were really truly meant to do when they went to school.
Absolutely. And first of all, we appreciate your support as an executive member of the Institute. But since we launched the Institute in April of 2019, shortly thereafter, we launched an employer advisory group because we believe strongly that the employers as health plan sponsor is a very, very important voice, and a voice that needs to be heard, particularly as it relates to the buying strategies that they use and the benefits that they provide to their employees.
As mentioned here, GTMRX has assembled a group of employer advisors. These advisors have helped us to assemble a wealth of resources to guide employers as the push for a new system of managing medications that is value-based. These can be found on our employer toolkit on our website. Now, back to the show.
Can you tell our listeners why employers as health plan sponsors should basically reframe their benefit strategy and use their contract authority with partners that will create a more aggressive way to manage medication therapy problems?
Yeah, I think one of the challenges is that they are generally a lot of times the individuals who are working in the arena of deciding about health plans, benefits, and contracts. They're being tasked with many things. And obviously now in the last 2 to 3 years are tasked with many layers of conversation given our current environment. And I think that historically, we have been cognizant of contracting, and pharmacy benefit managers are helping these employers hopefully achieve the best contracts. But we've layered in complications for these employers, and so it becomes all about the bottom dollar of the pharmaceutical spend that they're using. And I think what's happening is we're forgetting to give the employers the perspective of what happens in a healthcare continuum for an individual who may have 10 or more prescriptions that they're taking for more chronic conditions. The complexity of healthcare for them is beyond just what's the cheapest medication. That's a layer for them for sure. But what's happening is that I think we're layering in so many filters and management for the cost and access to medications that we also are forgetting the fact that each individual has a medication regimen that not only is cost effective, but also is safe and efficacious, which produces the outcomes. So I think employers need help in their busy days and their strapped for time of leaning on the education and understanding that medications it's more than just an adherence conversation. It's more than just a cost conversation. Getting the right medication mix for an individual as chronic conditions leads to lower cost on the medical side, which is the piece I think when you say pharmacy, people automatically flip to, oh, this is a conversation about cost.
Yeah, I think that's a very good point. And, we have long focused on moving beyond just management of the pill, which is formulary management or rebates or getting the best deal you can get on that specific medication, to really, really looking at appropriate use of medications and the process of care, and ensuring that there is a more rational process of care to ensure that we step back and basically say, is this the right medication or combination of medications for this individual? Jessica, how big of an issue is this, and why have employers not focused in the past on managing health benefits with these more innovative programs, or the programs that you both manage and offer to employers? Why have they historically only focused on adherence programs and not on broader programs that focus on solving medication therapy problems that we know creates upwards to $528 billion a year in waste.
Yeah, I think it has to do a little bit with them leaning on the partners that they have right now, which are their PBMs. And PBMs obviously have a role of ensuring appropriate utilization management. I think the challenge is if you look at incentives aligned with some of those vendors, sometimes the conversation is about filling prescriptions and the right formulary drug rather than ensuring that the medication outcome is the right fit for that individual. The most expensive medication that we could talk about is the medication that someone's taking daily and are adhering to it, but it's not getting them where they need to be. We all know the Million Hearts campaign is a great example where we looked at Americans who had hypertension, and over 50% of the patients were taking the medications that were prescribed, but they weren't achieving a blood pressure lowering that actually reduced the risk of stroke and heart attack. And at the end of the day, to me, that's the most expensive pill there is, because it's definitely waste.
Another factor driving additional expenses for employers is the fact that per person annual spending is 59% higher for employees with one chronic health condition and 82% higher for those with two or more chronic conditions. Further, employees with chronic illness have higher absenteeism. For example, workers with diabetes miss an average of 5.5 additional workdays per year. Now let's continue to listen.
And I think what we don't have for these very busy HR benefits individuals, employers who are focused on trying to, do their daily business and do what they're in the business to do, is be able to have a resource for them that helps them to understand that at the end of the day, it's beyond just what the profit and loss sheet says for their employer, their health plan. It's about what they're doing for their members to achieve the health outcomes. So I think we don't ever get to that health outcomes conversation. And so we need to continue to focus on helping employers understand that each individual who has a chronic condition needs a resource like a pharmacist who is solo only working on helping to ensure that the medication mix that they're taking is achieving the outcomes for their disease states, which allows for them to hopefully have reduced high-cost medication channel usage and hopefully improve quality of life as well. So to me, it's about continuing to help people understand that medications are individualized, that they have different outcomes for different people, and we can't just look at utilization and formulary mix. We've got to look at what's right for the individual that produces the best outcomes. And pharmacists who are focused on that can do that. But at the end of the day, you've got to take the pharmacist out of the role of trying to dispense per se and trying to be focused on all the other things that are coming at a pharmacist in a retail world right now. The layer of COVID vaccinations, the layer of COVID testing, all going on while trying to dispense the right medication into the pill bottle takes away from the ability to really focus on what's going on with the individual they're working with.
Yeah. And of course, we're talking about a patient care process, or the clinical pharmacist being involved in the patient care process, not so much the dispensing process. And when we're talking about medication therapy problems, you mentioned, and I brought up adherence. If you look at the broad spectrum of medication therapy problems, adherence only drives about 15% of non-optimized medication use. You've got a much broader area. Inadequate therapy is about 56%, and then dose too high is about 7%, and adverse reactions, another 15%. And then unnecessary therapy, another 7%. So there's a whole range of medication therapy problems that really can be managed more appropriately with an interprofessional team, where that clinical pharmacist is the medication expert on that team.
The stats on non-optimized medication use just mentioned come from a report from the American College of Clinical Pharmacy entitled Comprehensive Medication Management in Team-Based Care. This study illuminates where the medication issues that we should be addressing are occurring. As Katie mentioned, much of the current emphasis is placed on adherence, which only accounts for less than 15% of all medication therapy problems. That is why we must look beyond adherence to fix our trial and error system of medication management. Back to Katie.
You also mentioned, Jessica, and I appreciate this because I think bringing this up is very important. It's important that we step back and identify those patients that have not achieved clinical goals of therapy as the first step. And I think that you mentioned, the most expensive medication is one that's not appropriately used. So I think all of your comments are very appropriate as it relates to that. Building off of all of that, what do you see as the three most important things that employers should focus on when managing their prescription benefit program?
Yeah, I think that when an employer is managing their prescription benefit program, I think they obviously have to keep their eye on cost and utilization, and that's what the PBMs are helping them to do. But I think there are a couple of other key pieces that they have to focus on. I think ensuring that the medications provide the right outcomes is rooted in ensuring that there are pharmacists available for their members who have chronic conditions, individuals who have multiple medications and multiple chronic conditions, multiple physicians. Having a pharmacist who's really focused on ensuring that the med is producing the right outcome is the key. And a lot of times that's not available necessarily within their PBM environment or other environments. So that's really important. I think it's really important for them to think about their healthcare cost as a pharmacy and healthcare component together. There's not a silo for pharmacy. Pharmacy leads to hopefully reduced utilization in high cost channels. So if you're ensuring that your individual who has diabetes is taking the right medication that works for them and they're reducing their symptoms and improving their overall health, that means reduction in high cost utilization channels, which is not just a pharmacy conversation, but a medical conversation as well. And I think lastly, just ensuring that the right advocate is there as an education component for these individuals who are navigating a very complex healthcare system. We a lot of times here at Tria find that our pharmacists are doing so much more than just educating on the medication and the disease states and how they work. They're doing a ton of education on preventative services, also educating on how to properly access things within their health plans. And I think those resources and education components that a pharmacist can uniquely provide as it relates to the right medication with the right condition is really key to help driving overall improvement in healthcare costs, which is critical to any individual who is accessing and purchasing healthcare benefits on behalf of their employer.
Tria Health is an executive member of the GTMRX Institute, and their support is crucial to the work we do. GTMRX relies on financial support from those who share our mission and vision. We would like to thank the organizations who have already pledged their support to our work. These organizations include our founding funders: the American Society of Health System Pharmacists, Johnson & Johnson, and the American College of Clinical Pharmacy. Our executive members: California Chronic Care Coalition, Kaiser Permanente, Tabula Rasa Healthcare, Tria Health, and the Department of Veterans Affairs. And our strategic partners: AbbVie, the American Association of Colleges of Pharmacy, Amgen, Association for Accessible Medicines, Avera, Breast Cancer Index, Cleveland Clinic, Coalition of State Rheumatology Organizations, the College of Psychiatric and Neurologic Pharmacists, Curator, Empirex, Genentech, Genomind, the Journal of Precision Medicine, Kimber Booth, LabCorp, the National Alliance of Healthcare Purchaser Coalitions, OneOhm, the Partners in Care Foundation, FACT-MI, and the Teachers Retirement System of Kentucky. Their support is essential to advancing CMM. Now, back to the show.
Absolutely. And I think you're spot on, Jessica, as it relates to recognizing that these are medical cost discussions as well as pharmacy cost conversations, and that it will impact total cost of care if you get the medications right. And in our work with employers, oftentimes they're frustrated because the traditional programs delivered by their PBM partners fall short of ensuring that those individuals receive the most appropriate medications. So thank you for your comments there. I think it's important that we stress, and we certainly stress this within the Institute and through the toolkit that we created through the employer advisory group, that they really need to go beyond focusing on the pill formularies, the drug cost. Not that they should be ignored in any shape, form, or fashion, but also focus on a process of care and actually consider how medications are being used, how they're being managed, and how they're being evaluated. Now, identifying patients that have not achieved a clinical goal of therapy is an important first step, and I mentioned that earlier. Can you tell us a little bit about how you approach this within Tria Health?
Yeah, at Tria Health, we are utilizing the data that is being generated from pharmacy benefit claims along with medical data to help merge the ability to see the individuals who may be indicating, based on their utilization of medications and perhaps even utilization of the medical system, who would be best aligned to get resources such as a pharmacist focusing on them and their situation to help drive outcomes. So we really are looking for complexity in medication regimen, complexity in disease state, and looking at those individuals who have that level of complexity and who could benefit from having a pharmacist help create simplification of their medication regimen. And it's interesting, you've mentioned this previously with regards to drug related problems and drug therapy problems and the types of things that we as pharmacists regularly see within the healthcare system. A lot of times I think the implication is that a pharmacist equals adding on medications. And ironically, we see often, as you had mentioned, about 10% of the time, sometimes people are on medications they don't even know why they're taking
Yeah.
them. So it's about making sure that the medication regimen is right for individuals. Pharmacists don't necessarily want there to be always medications. We're focused on ensuring good health with patients. So that's an interesting component to it as well.
Yeah, I think there's a much broader discussion we could have about deprescribing and the importance of deprescribing and stopping medications that really are offering no clinical gains for that individual as well. So I think that's a very good point. Now, I'm sure you're aware, because you are accountable back to your clients and your customers, that there's a significant return on investment of taking a person-centered and team-based approach to managing medications. The Institute, we call that process of care comprehensive medication management. And it's been well documented, with some saying there's an average of a 3-to-1 to 5-to-1 and as high as a 12-to-1 in dollars return on investment. And it could result in a reduction in the direct mean medical cost of between $1,200 and $1,872 per patient per year for, each of the first 5 years for those patients with chronic conditions. The evidence of its effectiveness continues to grow. Why do you think that there's hesitation from employers to not only demand these services from those that they are doing business with, like their medical carriers, their self-insured, or if they're fully insured, their health plans or their PBMs? Why do you think there's resistance to ask for these types of services or to direct them to develop these types of programs?
Well, I think sometimes when you talk about return on investment, for us at Trio, since day one, I think a lot of times when you're talking about individuals who are purchasing healthcare for their organization, the conversation is return on investment. And they want to know, if I give you $1, am I going to get $1 back in return for that? And I think at the end of the day, in short term, CMM can provide definitely return on investment in terms of cost related, hard dollar cost related to pharmacy mix. But long term, it takes some time. And then you mentioned that 5-year window. Sometimes it takes time for the process of care to occur, which then helps to improve some of the utilization of the high cost channels. So to me, I think it's about a little bit of a combination of understanding that there's some short term gain in terms of cost and you may get a return on investment early on of approximately, 1-to-1 for those cost savings as it relates to the drug mix or the deprescribing that we reference. But sometimes that whole process of improving individuals' health by achieving the right medication regimen is not short term. It takes a little bit longer. And that's where you get into the conversation of the value of investment and ensuring that the value of the medications that you are paying for these individuals who work for you and underneath your health plan are actually getting the outcomes they expect, and you're actually seeing improvement in that. And I think, to me, that sometimes is hard to grasp, that this is not a band-aid fix, but this is a long-term gain on overall health with members who have these conditions who are costing your health plan lots of money. For us, we at Tria have seen improvement in utilization, decreased utilization of ER visits, and decreased utilization of inpatient stays and lengths of stays, secondary to the fact that we're improving the medication regimens one patient at a time, one medication at a time. So sometimes I think it's actually the trajectory of how long it takes, but I also think reframing it into this is a value of investment rather than it just being a return on investment. I'm going to get my dollar back after I put a dollar in, kind of a conversation.
Yeah, I think those are all very good points. And of course, you interface with the employer community directly, but you also work with brokers and consultants and work with them to encourage them to recommend to their clients that they invest in these types of services. So I am sure that the conversations that you have both with the brokers and the consultants are quite interesting as it relates to long-term value, the long-term investment. From your standpoint and your book of business, what are some of the types of returns that you're seeing outside of reduction in ER visits and reduced hospitalizations? And what can you share with our listeners about those results?
Well, you have mentioned some numbers earlier, and I would say, Katie, that we're right in line with a lot of that information. We are returning for our clients an average of 3.5 to 1 on their investment, and we're able to not only just look at hopefully the access to care channels, but also helping to improve the formulary mix, i.e., are the patients using the right medication for them that tries to align with cost for the employer. So we're seeing around a 3.5 to 1 average for our book of business over the last several years for a return in terms of investing in a product like Tria's or a CMM product. In terms of individual patient savings, we also would average out on our book of business at about $2,500 savings per patient per year in improved cost as it relates to accessing high cost channels. So there's some similarities with the evidence that you're referencing that are out there in the disease state chronic medication management arena. And I think beyond that, educating our brokers and consultants that the services we provide go beyond just spreadsheeting a list of medications to make sure you're accessing the cost. I think that education component for brokers and consultants has been critical to helping ensure that employers are getting what they need as well.
Yeah, I think we would agree that this is an education process for employers as health plan sponsors and their consultants, because their consultants are being challenged to think about this in a whole new way and a much different way. It's not just about affordability of the drugs or access to the drugs, but it's about appropriate use of those medications and how that integrates into the medical spend as well. And you've mentioned that earlier. So in our employer toolkit, which we released last year, which was co-developed by a group of employer advisors that we are very pleased to have associated with the Institute, we urged employers to ally with their local business coalitions or their employer healthcare coalitions. And we also urged them to work with primary care practices within their own local communities to identify ways in which they could educate and bolster and support programs for their employees that may have many chronic conditions or seeing multiple physicians, and you've mentioned that, or on lots of medications, or what one of our leaders called the poly problem. What do you think that employers should be looking for in partners that offer solutions like the programs that you offer? I mean, what should be some of the buying criterion that they use as they look at partnering for these more innovative solutions?
Yeah, so obviously when you talk about employers, we know that each employer is unique in terms of their population, right? Some employers may have population-based employees that are mostly local, and in that instance, obviously finding a partner who could work with those employees one-on-one and focused on the process of medication usage, ensuring that they're going through a very clear process of, is this medication being used for the disease state to achieve the best outcomes is important. But a lot of times our employers are multi-site, multi-state, and they're across the board. So the key is to have pharmacists who are focused on the process of care as it relates to medications, but also I think ensuring that when those pharmacists are working with these individuals, they're able to document in a way that helps to show improvement in outcomes. And I think you're the best partner for an employer who's expected to show some type of improvement to their management and executive teams is that the partner they're working with is capable of providing pharmacists in the role of helping in the process care of medication usage for individuals, but also being able to produce reporting and outcomes for those employer and employee benefit professionals to be able to show the value of the services that are being provided. And we as pharmacists need to continue to strive to be documenting not just cost conversations, but conversations around the fact that we're improving individual health outcomes related to these chronic disease states that members are dealing with. Because I think for so long we've focused on just the cost. We've got to focus on, are we improving the health of these individuals? Are we improving their disease states from getting better? Are they getting better? Because I think that's when we'll start to get into that conversation, the value of the investment, the value of a resource like a pharmacist being in a consultative arrangement with the physician and the member to drive the best outcomes.
Yeah, and when you consider, Jessica, that 80% of the way we treat and prevent illness is through
Yeah.
medications, it should be a much bigger part of the conversation than it currently is. And we certainly at the Institute are committed to making sure that that is the case and that we reframe these discussions to move beyond just a formulary discussion to one of how can this really impact total cost of care, but most importantly, the health of populations as well. Well, Jessica, there's certainly a lot more that we can discuss, and I hope you're able to come back on Voices of Change and join us at another point. But we're nearing the end of the show. But before we stop, I wanted to give you an opportunity for a final word.
Well, I appreciate that, and I appreciate you inviting me on today to talk about something that matters a lot to me. I would say that, when I went to pharmacy school with the intention of becoming a clinical practitioner, a pharmacist involved in the care of patients, I really wanted to revisit that sort of 1950s pharmacist in a community who was working with patients and knew them by name and knew what was going on in their family, but mostly knew what was going on with their healthcare process. And so I would just say that we as constituents, we as individuals involved in healthcare need to continue to focus on ensuring that we're focused with pharmacists, that they are a part of the care continuum, that they are a part of the conversation with physicians and patients, and that our purpose is to become advocates and improved members of the care team by improving outcomes for patients and not just become stuck in the delivery of just putting medications in a bottle. At the end of the day, pharmacists are about caring for patients, and that's what CMM is all about. So I just appreciate the opportunity to continue to speak my voice about something that I think is very important in improving healthcare outcomes today.
So thank you so much, Jessica, for taking the time out to speak with us today, and also for offering your insight and your perspective. I also want to thank you and Tria Health for supporting the work of the Get the Medications Right Institute. That ends our series today. Until next time, be well.
That marks the end of this episode of Voices of Change. Thanks to our listeners for tuning in. For those of our listeners who would like to learn more about Jessica's work and the work of Tria Health, you'll find that information on their website at triahealth.com. To learn more about the work of the Institute, please visit us at www.gtmr.org. And make sure to follow us on LinkedIn, Twitter, and Facebook.